Well, here we are again. I'm Dr. Aaron Lewis, and I'm with my dear friend, my sister, um, Dr. Theresa Deisher. Welcome on this beautiful day. At least it's beautiful where we are here in Connecticut, because it's sunny for the first time in about 4 days. It rained every single day, and I know it rains a lot where you are too. What's the weather like today?
Gray and raining.
Is it really raining?
Yeah.
Oh my goodness. Okay, so you're not as fortunate as we are today, but I'm sure that the sun will come at some point.
Every day I'm blessed.
Well, that's a beautiful thing. Every day, that's a beautiful thing. I want to welcome you to this conversation. I believe we're going to have a wonderful and insightful time on today. And so, for those in our listening audience that do not know who Dr. Theresa Deisher is, she is the president and founder of Sound Choice, a tremendous organization that's based out of Seattle, Washington. And I'm going to give her the opportunity to share a little bit about what Sound Choice is and what it does.
Well, thank you. I guess I should tell them a little bit about myself first, and then
Sure.
I'll explain how I came to found Sound Choice. I was educated as an undergrad as well as a graduate student at Stanford University, and obtained my PhD in molecular and cellular physiology from the Stanford Medical School in 1990. Yeah, I postdoced in the hematology division at the University of Washington, and since that time, I spent my career in the biotechnology and pharmaceutical industry. I was blessed to work for companies like Genentech and Zymogenetics, Immunex, and Amgen, where I got just phenomenal training and preparation. I founded AVM Biotechnology, my own biotech company, in 2008, and Sound Choice Pharmaceutical Institute. It's www.soundchoice.org in June of 2008. And the missions of both organizations are very complementary. That's to end human exploitation in biomedical research, drug development, and medical practice. So Sound Choice, our nonprofit arm, really is focused now on shedding the light and the truth and letting people know about what goes on a daily basis, exploiting other human beings for biomedical advances. In the past, we've done significant amount of actually wet lab research on the public health consequences and the biology, the results to our physical bodies of what has been done also, and published peer-reviewed papers on that topic. I was a plaintiff in the Shirley versus Sebelius federal lawsuit that shut down embryonic stem cell funding.
Wow.
And that few years of shutting down and stalling that allowed adult stem cells to make it into clinic and basically win the race, so that most people don't feel a need to reach and try to use aborted fetal cells or embryonic stem cells.
Wow.
So
that's a lot. That's powerful. Now I'm hearing the words embryonic. I'm hearing aborted fetal stem cells quite often in your language, and so of course the question will come. Explain how this has to do with babies and embryos. Like what's going on here? Like let's talk about that. Like because when you say this, some people may think, oh, she's using figurative language, but the look on your face doesn't sound like none of this is figurative. You sound like you literally mean embryos, something that's in the stomach of a woman carrying a child. Am I correct about that?
correct. I mean, an embryo is the name that's given for the early human development, and some people consider the baby to be embryonic until about 8 weeks of gestation or formation. So, what happens on a daily basis is the, bodies of electively aborted babies are used in research laboratories, particularly academic research laboratories for experimentation. And, this practice, I think, is horrific enough. But what's really even more horrifying is that in order to obtain really good hearts and brains for the research that is done, the babies, they like 5 to 6 month old preborn babies, and the babies have to be alive when the organs are removed.
Wait. Pump the brakes on this. Okay. This is some real serious information. Wait. So they're researching on these unborn babies. You're telling me we're not even talking in the first few weeks of conception. You said 4 or 5 months or more?
5 to 6 months, correct?
5, 6 months, and you're saying that these babies that are, I mean, a baby that's 5, 6 months can live if it was, delivered. And so you're saying that these babies are at this stage of the pregnancy and they're aborted, and then they are brought into is it a laboratory? Like, explain what happens here.
Well, so to get, to do heart research, you need a beating heart. And, it's just logical. If I'm just going to remind everyone, death is not relaxation. Death is contraction, rigor mortis, right?
Wow.
We don't become sludge when we die. We become solid rock, right? Later you decompose. But
Right.
so a heart that is, deprived of oxygen almost immediately contracts and becomes like rock. And you can't do research on that. And so, like for a heart transplant, what they do is they actually, while the heart is still in the donor and the heart is beating, so in essence, the donor is actually still alive, they perfuse into their veins and their arteries a fluid that makes the heart relax. And that's called diastole. So there are different solutions that do that. Then they take the heart out. So when it stays in a relaxed state, you can get it to beat again. So when they're doing research and they want heart tissue from an aborted baby, a lot of publications talk about 22 weeks. That's between 5 and 6 months. The babies are not aborted. They're delivered intact and they're alive. And they are alive until they cut their hearts out and they drop them in a relaxing solution immediately.
Okay.
So that then they can transport it to a lab to do research.
Okay, Doc, listen. What you're saying sounds like something that, some, medieval, crazy Galactica, it sounds nonsensical to most human beings. And then it even sounds even more outer space or otherworldly to people that live in the great United States of America. So let's deal with that. This doesn't happen nowhere in our country, does it?
It does.
Like in the United States of America?
Yes, it happens.
Okay.
At University of Washington and the University of Maryland are two of the biggest fetal tissue suppliers to the world.
Are you kidding? Okay, wait. This is something that is new to me. Just the knowledge of this, it's new to me. It's not only horrifying, it shocks me to my core, because this is something that's done that I don't know that the average person, I would assume that the average person has no idea. What has your experience been with clerics around the United States of America? You said the University of Maryland. That's it's a few hours from where I live, and and University of Washington. Is that the one um,
Seattle.
in Seattle? Okay, and so this is unreal. I mean, I'm not even certain how to respond to this. But what has been your experience in the work that you do with giving people awareness concerning the issue? Have you seen hundreds of thousands of pastors and imams and rabbis coming to support the cause and to make people aware of this? Or have you seen people coming on board very, very slowly? Like, have you gotten resistance? What's been happening when you spread this news? Because this is horrific news.
So I think it's so horrific. Most people don't want to um, really acknowledge it. I mean, we wouldn't even do that to a mouse. And the practice is driven a lot by like animal rights groups
Right.
and, and there's other factors. I think many of the people doing the harvesting and doing the research, I think they know not what they do. And it is absolutely horrific. I was the scientist who told David Daleiden about this practice, and in hearing about that, he formed the Center for Medical Progress, and they went
Now who's
undercover.
David Delight? Tell me who David Delight is.
David Daleiden was one of the founders of the Center for Medical Progress,
Mhm.
and he and another woman formed a fake company, Tissue Procurement,
Mhm.
and they went undercover into Planned Parenthood and other abortion facilities and demonstrated on cameras that this was being done. And
Wow.
there have been, some lawsuits against the organizations doing this, but the biggest lawsuit is, David Daleiden and Sandra Merritt revealed a horrific crime. And I mean, as a society, as a people, we are better than this.
Right, right.
I mean, we wouldn't sanction this done to a mouse. We don't do this to mice. And the result is lawsuits filed against them and criminal charges pressed against them, where if you suspect a crime is occurring and what is done is still a crime in the United States, you can lawfully go undercover. I mean, it's just amazing what's been done, what's being done, and how they're being pursued. And if the people pursuing them would just step back and think about what they're supporting, I mean, they would horrify themselves.
So, so the reaction that a lot of people, you're saying, the initial reaction is, it's so big of a situation. It's so large that I don't want to deal with it. Is that typically the initial response that you get? Because I'm just the complete total opposite. I've always been an extremely bold soul, and even if I have to die for a cause, I'm very, very prepared to do so. So I've never lived with the fear that the typical human being lives with. But are you seeing that most people are saying, "Oh, this information is so it's so above me, it's so beyond me. I don't want to have nothing to do with it. Just let it keep happening." Is that kind of the response that you're seeing? Or I mean, what's going on with that?
Well, when I first heard about it, about the ability to get beating heart cells, you could buy them from a company. I was told that it was from miscarriages. And to work with animals is so tedious. I wanted to be able to buy those cells. And I remember announcing to my research group that we were going to get cells. And one of my staff who reported to me said, "Well, where do those cells come from?" And I said, "Oh, don't worry, they come from miscarriages." And she looked at me and she said, "How can you be so gullible?" And I stepped back, and instead of firing her, I thought about it. It's like, oh my gosh, she's right. Because, and you have to think about it, miscarriages happen over days.
Right.
The baby's heart isn't beating when the body is finally expelled. That
Right.
tissue is not viable. It cannot possibly be from miscarriages. And that's when I started researching the practice and was shocked at the things that I found. This was back in the late 1990s. And I provided a lot of this evidence to human life groups. And back then, even CBS carried it. People were horrified, and it was kind of shut down and it hid. And
Why?
then,
Why did they hid it? Why did they hide it? Why?
well, because people were horrified at that time in the 2000, exposure. And then they just, people stop paying attention, and then they just kind of start doing it again and building it back up. And now it's actually shocking to me the number of people who've heard about this, who know about this, and who don't want to care about it. They don't want to worry about it. And I do have people tell me many times, well, I'm sure it's from miscarriages. No, it's not from miscarriages. It's not possible.